Hey, it's Dr. J with another session of Ask Dr. J, where I will respond to questions that come my way. And today's question is, does my child need a frenectomy? Well, first and foremost, frenectomy is a procedure where if a child has a tethered tissue, so it's usually either the lip, so call that a lip tie, or the tongue, call that a tongue tie, is present where it is impeding function of the child's day-to-day activities. So the most common place where I get this question is parents who feel that their child is tongue-tied. So tongue-tied probably falls into two categories. It's the youngest kids in one category and the older ones in the other. So the younger kids, I'm talking about really newborns and toddlers who are breastfeeding, and kids with tongue ties can absolutely have increased difficulty with latching to the breast or even taking a bottle because the more severe tongue ties definitely and absolutely limit the range of motion of the tongue to a point where it can be very painful when the child latches and they just don't latch for very long and they get a lot of air in between um, every time they suck, and so they tend to have a lot of reflux, a lot of GERD, really not feed well. So it's definitely something that should be considered, but it definitely requires a hands-on evaluation by a trained provider. And these providers nowadays could range anywhere from ENT physicians, surgeons, I should say, to pediatricians, and certainly the realm of pediatric dentistry has come a long ways in the last, I would say, 5 years in being able to help um, these newborns and toddlers be able to latch and breastfeed longer or even bottle feed with less reflux and GERD issues. The second category is the older kids, excuse me. And with the older kids, probably the most apparent way to evaluate them is to see the range of motion of their tongue. So if a child is opening their mouth, can they stick their tongue up and out and sort of sweep across their upper lip, or do they end up having it closed to be able to reach their upper lip? That's probably a good layperson's way to evaluate. And certainly, the tongue is a muscle, and like any uh, bodily organ, if its range of motion or its function is limited, there are ramifications which should be considered. And the good news is frenectomies could be done and are being done very safely, be it for the very young or the older kids. And there are different categories, conventional and or laser frenectomies that could be done, which we can make another video on later. But to summarize, we could have lip or tongue ties, and they could definitely affect the child's form and function, and there are safe ways to address them with the procedure called a frenectomy. So anyhow, please do keep those questions coming and keep smiling. We'll see you guys next time with another session of hashtag Ask Dr. J. Take care.